gastroparesis, which is basically your stomach is paralyzed, so your food doesn't digest. So instead, you throw up and vomit and nausea. I'll go into more detail about it, but I just wanted to say thank you for having me and letting me come speak to you guys.
You said it twice. You did it twice. There you go.
That's cool. I was always very healthy when I was growing up. Maybe ear infections every once in a while, but other than that, I was fine. I did soccer, I did dance, gymnastics. I was in school, and when I turned 16, I had a bad stomach virus, and it lasted for about 2 to 3 weeks, and it ended me up in the emergency room. I had dehydration, and ever since then, my symptoms of nausea and vomiting never went away. They just got worse. So I have nausea, vomiting, and when I vomit, it's undigested, and that's part of the gastroparesis. So I'll get sick, and then 10 to 12 hours later, I'll throw up, and I'll see what I had for breakfast. So that's one of the main symptoms of gastroparesis is the undigested food coming up. You always have really bad abdominal pain, and usually it's upper abdominal pain where your stomach is. You get bloating a lot, which is no fun. We call them food babies sometimes because it looks like you're 6 months pregnant or something, so we just say it's our food babies. You feel full after a few bites. I can never finish a meal. If I go out to eat or something, I have to be very careful on what I'm eating. I can't have fried foods, can't have chocolate, I can't have a hamburger. I haven't had one of those in 4.5 years. You also have weight loss. When I first started getting sick, I lost 30 pounds. Also another thing is weight gain if your body goes into starvation mode. And that's kind of a hard misconception with gastroparesis that a lot of doctors have a hard time understanding because most people are losing weight and then there's people that gain weight with it. And they're but if you're gaining weight, you're fine and all this stuff. So that makes it hard to get a diagnosis at times. And then you get dehydration because you can't keep anything down, and you also have acid reflux. So all the time your esophagus just burns. I've had frequent hospitalizations. This year I've spent 2 months in the hospital. And other than that, I've been on home health. So you get IV fluids when you're dehydrated, and usually IV medication. I do Zofran through IV when I'm in the hospital is the main one they give me, and IV Phenergan for nausea. And then sometimes they'll give you pain medicines for your abdominal pain, but that's also contradicting thing because it slows your stomach down. So your stomach's already paralyzed, so that kind of makes it hard to do. I've been sick since May of 2008, and since then I've had 50 hospital stays, and sometimes they range from maybe 3 or 4 days, and sometimes they'll be a month stay. So that makes it hard to do normal activities. This is easy. When looking for a diagnosis, it's hard because a lot of doctors aren't aware of what gastroparesis is, and a lot of people get misdiagnosed. I was diagnosed with cyclic vomiting syndrome, and they thought that it was just I had migraines in my stomach, and that it would just go in cycles with my vomiting and my nausea. And I'm okay, if that was that, I would have periods where I would be fine, but mine was just all the time. So a lot of people, they get misdiagnosed with Crohn's disease or IBS and things like that. Some of the testing that they do when looking for gastroparesis is abdominal x-rays, CT scans. They do a lot of endoscopies to check and make sure like your stomach is okay and it's not like any ulcers or things like that, or reflux. They try to make sure that your esophagus is okay as well. They also have the upper GI, which is really gross because you have to drink this barium swallow stuff, and it's like a big size of it, and it's really hard to keep down, especially when you're already nauseous. The test that diagnosed me with gastroparesis was the gastric emptying scan. And has anybody ever heard of that before? It's basically like where you go. Mine was done at an outpatient center, and I had to be there for 4 hours. They had me eat radioactive eggs. They put some kind of radioactive thing in them, and then you had to eat them. And then every hour they would take an x-ray, and then the x-ray would show like where, it would highlight where the food is in your stomach and how long it takes to pass it through. And I found this online. This isn't mine, but this is an example of what a gastric emptying study looks like. It highlights like where you can see the food and how it like moves through your stomach. Mine after 4 hours was only a small trace of it had moved through. And most people, they can like digest their food within like an hour or so. So mine was still like, all my food was at the top of my esophagus and my stomach. And after that, I immediately got sick. It was hard keeping it down the whole time. But that was the test that diagnosed me. So July of 2009, it took a year to get a diagnosis that was correct. I got diagnosed with gastroparesis, which is basically your stomach is paralyzed. It's also known as a delayed gastric emptying. So basically, like your stomach takes longer to empty than a normal person's would. It has no cure and very little treatment options. So it's hard to manage it because some of the medicines that are available are only effective in treating the symptoms and not really the cause of it. This is just so cool. The causes of gastroparesis, the main one is diabetes. It can be a result of diabetes as it progresses. It can also be post-surgical if the vagus nerve is damaged, or it can be idiopathic, which is an unknown cause, or as we like to say, like the doctors just don't know what caused it. Autoimmune diseases can also cause it, like lupus or things like that. Mitochondrial disease, which affects your organs, that can be a result of gastroparesis. Neurological diseases, eating disorders, and mine was the stomach virus. So there's a bunch of different things that can cause it. Diabetes is the main one, but a lot of people have idiopathic, they're not sure. So the treatment options are, and I'll go into detail on these in a minute, but diet changes, medications, feeding tubes, TPN, a gastric neurostimulator, which I have, Botox, not like to make your lips bigger or anything like that, but they inject it into your stomach. A gastrectomy where they remove half or your whole stomach, or in like the last resort, a multivisceral organ transplant. So, diet changes. With gastroparesis, it's hard to keep foods down, so you want to look for foods that are easy to digest. So a lot of things like bland foods, usually they recommend like applesauce or rice or mashed potatoes, things like that. Or soups or like Gatorade or water and things. Some foods to avoid is red meat, the hamburgers, French fries, which is really bad because French fries are my weakness. Chocolate, and everybody's foods to avoid are different. Some people are able to eat some things and some people aren't, so it just really depends on the person. And that makes it difficult too because it is gastroparesis, but everybody's gastroparesis is different and the severity of it is different as well. But you also want to make sure that you're eating smaller, frequent meals because you get full really easily. So like if you go to Chili's or something and get like the big pasta or something, maybe you only eat like a fourth of it. So this is like the pharmacy part of it. There's like different medicines for gastroparesis. Some control the symptoms and help you ease those, and some are for motility. But the problem with these are some of them are not FDA approved, and some of them you have to get in other countries. So that makes it difficult, or they have really bad side effects. The medicines that I've tried are Zofran, Phenergan, Nexium, Peptid, Compazine, and erythromycin and Reglan. The Zofran and the Phenergan help control my nausea, and I'm actually on Phenergan right now. The Nexium and the Peptid are supposed to help with like your reflux. Compazine is also used for nausea. And Marinol is like the medical marijuana thing. I haven't tried it, but I know people that have. I just feel funny about that. But and Elavil, sometimes they use like antidepressants as well in small doses to help control your nausea. And then motility medicines are supposed to help ease digestion, because with gastroparesis you have delayed gastric emptying. So sometimes your stomach will take a day to empty or longer than a normal healthy person's would. Erythromycin they use to help ease the digestion, and the Reglan they use that as well, but it has like a black box warning on it now, so it can cause some severe side effects. With me, it made my hands clench up, and then like my mom would have to pry them open. And then domperidone is not available in the United States. You have to get it from like Canada or New Zealand or something. So it's hard to have access to it because it's not FDA approved in the United States, at least that I know of. So that's me with feeding tube. That was my first one. I had an NG feeding tube, and that was to help like vent my stomach. But they also have NJ tubes to help with feeding, and a dog paw feeding tube, which I've had before. I haven't had a tube in my abdomen, but the tubes you can get are a J tube, G tube, and a GJ tube. And those are for when you can't control it with diet changes or medicines. The Botox injections, they're injected through an endoscopy, so like you're put to sleep for it and everything. They inject it into the pyloric sphincter, and it's supposed to help ease digestion. The only problem with it is it doesn't last very long. So some people it'll work for them for like a week and then they'll need another one, and some people it'll take like a month and it'll work, but then your symptoms come back. So that's the only problem with that. In severe cases, they have where you can get an organ transplant, and the founder of the gastroparesis organization called G-PACT, she had a multivisceral organ transplant, and it's your stomach, your small bowel, your duodenum, your liver, and your pancreas. Another thing they can do is a gastrectomy, where they remove part of your stomach or your whole stomach, but then you have like, you're not able to eat as well. So that makes things hard.